My name is Marge Smith. I'm a licensed psychologist here in Louisiana, and I'm a professor at Chicago School of Professional Psychology at Xavier University of Louisiana, and have a strong interest in the intersection of scholarship and activism, particularly around Indigenous populations. Thank you for having me.
Yes, we are so excited for you to be here. I'm going to go ahead and go to Kayla.
Ani Buju, Debika Nakwokwe, Nadishnika, Spanesian Dodom, Nindebikatum Donjaba, Anishinaabe Kwenda. My name is Kayla, and I am Anishinaabe from Northern Michigan. I have been living, working, and playing in Metro Detroit for about 13 years now. Came down for school and just never left. I obtained my master's degree in social work in 2017, and I've been working on federal government contracts for the past 5 years now for SAMHSA, the Substance Abuse and Mental Health Services Administration, as a tribal TTA coordinator. So I work specifically with a portfolio of Native grantees who receive grant funding for a variety of different things, mostly around substance abuse, mental health things, suicide prevention, intervention. But I also work on other contracts underneath that as well. I'm really pulled in a lot of different places, but all for Native people specifically. So, and sometimes non-Natives also contract with us to get some other like cultural competency type trainings and things. So that's my professional work, but I'm also a birth worker, Indigenous doula, healer. I do a lot of different things just in my own community for BIPOC people. And that's just a little bit about me.
Thank you so much. All right, Mary, round us out.
Hello, everyone. My name is Mary Davla Sheride. I'm a faculty at Texas A&M University at Galveston, and I'm by training hazard economist. I study impacts of the natural disasters on various margins. Primary focus has been on economic losses from disasters, but recently I've been also interested in the impacts on the health margins, such as like mental health issues and opioid dependence, how the disasters could exacerbate some of these health effects, and how we can better manage the public resources and provide the adequate infrastructure in terms of the public health services to address the consequences, in particular with the growing recognition that climate change is going to exacerbate and make these events more damaging, frequent, and more impactful for our societies. Thank you.
Thank you. It's a breadth and depth of knowledge that's represented on this panel. It's really exciting, and I look forward to hearing for it. I'm going to turn it over to Jasmine to lead us through the question and the rest of the panel, and I'll be back towards the end to manage your questions. Feel free to put those in the chat, and I'll be keeping an eye out for those and bring those up as they are relevant.
Awesome. Yes, thank you again for everybody who's here, and thank you to our panelists for sharing your expertise today. So our first question of our prepared questions is for Mary. Mary, you recently published a paper showing counties with greater numbers of climate disasters, and which also had high rates of opioid overdose. So what impact does this relationship between climate change and public health have in regions like the Southeast, where hurricanes and other climate disasters occur frequently in rural regions and which already have high rates of opioid overdose deaths?
Yeah, thank you for this question. It's a very interesting, very complex question to answer. Yes, I had this recent research where I look at the impacts of the natural disasters, and given that in the United States the hurricanes and the floodings are most prevalent disasters, and they're concentrated in coastal areas, in particular in the Southeast and Gulf region. We find that these disasters have not only immediate impacts in terms of the opioid dependence and subsequent mortality related to that, but also the very lingering impact that is seen in the even 10 years post-disaster. And there are several linkages that we tie to this. One, of course, related to the distress that may emerge because of the economic losses, because of the loss of the family or some other valuables to disaster. And of course, the destructions of the social ties, the ties to this community is a big contributing factors to this. And we expect that to see this impacts in like 10 years after the incidents. It's a very, very big finding, because most of the current emphasis when we talk about the implications and the impacts of disasters is in the developed countries such as United States and other developed countries in the world. We focus on the monetary losses because of the value of the assets that are exposed to these events, but not so much on the human impacts. But even the human impacts, the impacts are measured in terms of the deaths and the indirect like injuries associated with the disasters, which are lower in the US because of the warning systems and the early evacuation, essentially, that allows them and they actually think that hurricanes have been safe for humans because of that. But to narrowly define these health impacts, but by the direct injuries or the deaths to the disasters, is very limiting, because we do not account for the lingering factors in terms of the mental health. As far as the rural communities go, of course, these rural communities are more impacted by also disasters because they do not have a lot of capacity for rebuilding. And just recently we have done new research. We look at the federal disaster recovery money and how equity implications of it, and we find that some of the rural areas where people do not have lots of assets are disproportionately given less of a disaster aid, because this disaster aid also is directly related to the metric of the damages. And poor people generally in rural, they do not have valuable assets, and this creates a huge disparity in terms of the recovery. It could widen also gap. And related to the opioid deaths, we found that in some of the counties that are in severe persistent poverties, these are the counties that for the last 30 years have been poor, like more than 20% of the population have been in poverty, have been particularly impacted by this opioid epidemic. And the reality is that this deep poverty or persistent poverty counties are also in the deep south, like in the southeast regions, so where also disasters could further better their well-being and the welfare. So I think implications will be severe, and so there has to be coordinated efforts to provide the resources for these people to help them with the long-term recovery, not to yield such a fatal outcome that is the epidemic related to the overdose. Thank you.
Wow, that's amazing. So would you, just to kind of piggyback off of that, would you say that increase in kind of preventative counseling versus tackling the problem that's immediately in front of you is more important, or should those happen simultaneously?
I think there should be the simultaneous both preventative and recovery. In my research, I've looked at some of the recovery programs that Federal Emergency Management has in terms of the housing assistance, counseling, and some other services that they provide to people impacted by disasters. And these programs are particularly important for those. And we see that they reduce, essentially they offset the effects of the disasters in terms of the mortality. These types of program, like $1 spending, could be very effective to mitigate. So this suggests that post-disaster counseling, assistance with the needs that people might have are very important, but also pre-disaster somehow to identify the areas this could be are particularly vulnerable to these kinds of shocks, not only external shocks like disasters, but also health impacts. And we know that where the hotspots of opioids or the mental health generally is, I think to create some mental health facilities, because these areas like rural areas and those in persistent poverty are also deprived with this infrastructure. So I think channeling these researches towards those so they are better prepared with the coping and some other strategies would be important. And this has to be like I strongly believe at the federal level, because the local governments in these small and marginalized communities, they do not hold lots of resources or even administrative capacities to build their infrastructure.
Wow, yeah, so we have a lot of work to do with as far as the infrastructure. So let's move a little bit into the community. Kayla, How do Indigenous and other communities that are most marginalized, most impacted by large-scale crises, and least likely to be supported through existing structures and institutions, build resilience and healing?
I would say that it's all about culture as prevention, reclaiming our traditional ways of being, whether that's through food or through ceremony or tribal sovereignty, food sovereignty, all those different movements that are happening in Native communities. A lot of the work that I do, it is healing work. There's a variety of curriculums specifically for Native communities. There's one in particular that's the most popular all across the country that has been being used since the early 90s, which is called the GONA, the Gathering of Native Americans. That is a very powerful curriculum that we use, and it really takes you from the beginning to where we are now and how we got to where we are now. And a lot of that has to do with these 4 basic themes that go throughout it. So belonging, mastery, interdependence, and generosity. So we go from the beginning of first contact to things that happen in between there. It's really powerful. There's a lot of trust that gets built throughout that through various activities. And because of the pandemic, we've had to do a lot of it virtually, whereas we were doing it in person, but it's still just as powerful and impactful. And it's really a prevention and treatment, and it's a good way of measuring, assessing, resource mapping, getting the needs identified of the community, capacity building, and a lot of the funding grants that these communities get, that GONA is written into the grant where it's something that they need to do. Whether it's a 3-year grant, 5-year grant, they might need to have a couple of these trainings, but it's more than a training. It comes back to ceremony again, and we bring in all the different elements of that community through different forms of ceremony, using different medicines, songs, traditional songs, all those things. It all comes together. It's like the perfect curriculum for Native communities, honestly. But yeah, I think that all of that is a part of building resiliency and a part of doing different healing work. And I feel like I see that everywhere. I literally work with Native communities all the way from the East Coast to the West Coast and everything in between. So I think that most communities, if not all, have a variety of different action plans in place to help their communities heal from all the different disparities, especially being that Native people have the highest rates in everything that you can think of. Domestic violence, missing and murdered Indigenous women, opioid abuse, all the different, alcohol is everything. We literally top the charts for everything, and we have the smallest population, but we rank the highest. Incarceration, all those things. So I feel like everybody has a part to play in all that, and whether it's through doing those things or fighting for water rights, trying to close the pipelines, it's so much different work being done. And I think that a lot of people do that work as a part of their recovery. Part of their recovery is getting into that work, is reclaiming their traditional ways. And you can't do those things without coming back to your culture, without learning your language, without practicing those songs. All those things help with your own personal healing, and it helps bring the healing to the community as well. So just culture is prevention. That's the main going theme, I feel.
Wow.
Wow.
That's amazing. And that's actually a beautiful segue into Margaret's question, which is, can you, from your expertise, speak towards the importance of cultural competency in mental health care? And what are some challenges you faced while providing mental health support to Indigenous people who are on the front lines of the fight against climate change and the policies that accelerate it?
Sure, thank you. It's a wonderful question. Sorry, I have some unusual lighting situations here because in Louisiana, the sun is setting, and so that's what I'm getting here. So I think it's really incredibly important to understand that there's not just the mental health needs of the individual in the moment, but there's an entire historical context that goes into this. There's a multi-generational transmission of trauma that a lot of Native people have experienced, from the point of the invasion. And that in and of itself makes it difficult to be able to trust providers. So there's also a cultural context of that we're not one group. We have urban versus reservation, natives. We also have over 500 federally recognized tribes. And each, group, each nation has its own unique history, context, culture, language, values. While we have some pan-Indian things that we might share, we have a desire and a right to be able to be seen as we are and not stereotyped. Additional to that, many things that have gone the wayside in terms of mainstream culture stereotypes still exist for us today, such as the sports mascots and everything else. This is all like a part of our daily experience, whether it be like Halloween, people dressing like us, or it becomes microaggressions on a daily level, or being expected to be add water and mix instant experts on everything native, where not everyone is, familiar with their language or their culture as much as they might want to be, depending upon their context. So there's a lot that goes into that understanding of working, with different Native people. And then I think to go to your question of the work that I did at Standing Rock, an additional layer for activists there and ongoing, like with Line 3 and Enbridge, is the idea that because the media did not cover what was happening sufficiently, many of the people were experiencing surveillance, infiltration. There was, interference that was going on, and when they would naturally have normative, what I would call normative paranoia from these experiences ongoing. The real issue was that providers could inadvertently look at that and characterize it as, oh, that's pathology, that's paranoia, when in fact it was their experience. It was a very legitimate experience, and it's why Society of Indian Psychologists wanted to be able to make a statement about this, so that literally the activists could provide that, when they were talking with people. So just wanted to give you that, and, share a bit about that. I know that was my own personal experience as well, was, being under surveillance and having other colleagues think that I was just paranoid. And I'm like, this is a reality for us. And I think it's reality for a lot of activists, even outside of Indigenous communities.
Wow, thank you all for your perspectives. Let's open it up for a question that anybody can answer. So what are some of the major successes or stories that keep you inspired or give you hope while working in your field?
I can start. I'm an economist, so and the field that I study, it's may not excite people in a good way, because we do not really seek for the success. We try to understand the vulnerability and the misery, and just to figure out the ways how we can address them. But I think the exciting aspect is to see that in this research, at least, that how big of the role the community and the community ties can play in the recovery, in particular when the disaster strikes, and this community, and this disasters does not have to be like natural disaster. And also the pandemic has also proven that the social networking absolutely essential for our well-being and the happiness. But in the disaster literature, right, we see, and also in some of my research, we show that social capital is a very important capital for the mental health, for opioids, and capitalizing on some of the strengths that we already have is important. However, the challenge here is that I think this is where I get excited to figure out how we can address this, is that the social capital is also disrupted by disasters, like these extreme events force people to relocate, close some of the organizations, and this community groups that existed before. So, and these disruptions could impede the recovery, not only economic, but also social and the mental recovery. And this such extreme events also reshape the socio-economic fabric and demographic fabric of the community, which is absolutely integral part for many people because they have this attachment to the place, but the place is no longer the same as it used to because the disasters have caused so much disruption. And I think understanding these linkages is important for us to really use this strength, whether it's through because sometimes this monetary compensation does not compensate for the social ties that we lose. I think capitalizing on the social aspect of the disaster recovery is absolutely important, and this gets me excited to really understand and learn this topic even further. And also to the extent that I am able, I'd like to also advocate and show some of the findings of my research, and including this panel that I'm so excited to be part of. Thank you.
Wonderful. Anybody else?
I can jump in. I think the thing that excites me the most is just seeing the generations come together of Indigenous people. To me that, or actually any group, but to see that in terms of like activism around climate change is just very inspiring. It's because there's transmission of cultural knowledge through those steps.
Wonderful. Okay, so in that case, what are some unique challenges or learnings that have come out of your work due to the pandemic, especially with your work with some of the communities?
I can speak to that. I kind of already mentioned that with the work I do, I was traveling into communities at least once or twice a month, especially in the summer when youth are on summer break. I would go into a community for at least 4 or 5 days, twice a month, to facilitate different curriculums or support a variety of things, whether it's mental health first aid or the GONA or other things, QPR, a variety of things. Everything had to go virtual. And it took a little bit of time to adjust, but we found ways to engage through using Google Docs and being on Zoom and doing things where we have people going in and actually, in live time, filling out, different documents or things that we would have drew on big paper. Now we're copying and pasting images and just being as creative as possible, because with the pandemic, the rates of COVID were so high in Native communities. And I mean, personally, I can't tell you how many communities were just going through so much with all the deaths in their communities. And it was just impacting communities on a this crazy level. It was terrible, especially in the beginning. And then it wasn't just that, though. People were losing people left and right to COVID, but then also suicide rates went up high. We had a few crisis TA requests come in, and we're not a crisis center. There's other centers for that, but I feel like my team at SAMHSA, Tribal Tech, they're just, WOPLA as well, like it's all underneath the Tribal TTA Center umbrella, if that's what you want to call it. We all just felt so, I don't know, we just felt like we had to help. So we had a few TA requests that came in that really should have been sent somewhere else, but we had to get in there and we had to try to provide the best technical assistance and training that we could virtually to these communities. And I noticed as well, there's a lot of TA requests that would come in that were preventative. They knew that they were going to need support. They knew that with the COVID cases rising in their communities and the death rate, that they needed to have some type of training. And usually it was the GONA. There's a lot of other trainings as well, but they knew they needed that. And so, I was so busy this past year and a half. It was just one thing after another. But the good thing to come out of the pandemic was that we could reach more people on Zoom. In some communities, getting into the center or wherever it was, waiting, the planning period of finding a location to host, making sure there's food, because you gotta feed Native people. You can't call them in without food. So having all those things in line and then, you know, doing something on site can take a lot more time. But with virtual, we're just back to back to back. I mean, once I created a set of slides that went along with certain curriculums, because it didn't exist. I mean, they just didn't. We did this in person. Once we had those things going and we got a good flow, it was just back to back, constant trainings and just supporting these communities. So we could reach more. Not everyone always has babysitters. Not everyone has transportation. So I noticed that one good thing was that we had whole families on Zoom. It might have been just a youth going on or a training or just an adult training, but then you look, kids are running around the background, they're getting involved, which is, you know, really what it's all about, and that'd be fine. So we started making sure that when we sent kits out, like art kits and things to help with different parts of the training, that we asked them, like, how many people are in your household? Because we wanted to make sure that we use the grant funding and the monies that we had and put it back into those communities, because that's what it's there for. So sending extra supplies, making sure everyone had something to color with or draw with or make, you know, whatever it might have been. So yeah, we had to get really creative past going on 2 years now. So there's some good that has come out of it. That's all. Okay.
That's wonderful. And I think the most important part is that you're able to make an impact on some very, very marginalized and very needed communities. So yeah, we really applaud you for that. Okay, so what's our time right now? I guess we can transition into a Q&A.
Yeah, so I'm happy to bring in, we did get a question from the audience. So Ben has asked, and it's somewhat related to one of the questions we had shared with you earlier. What are the obstacles you see in delivering mental health resources to marginalized communities as part one? But additionally, building on that, what is your policy wish list? So thinking about how would you turn, you know, some of the barriers into actionable changes or policies, what is on your policy wish list related to removing some of these obstacles?
I can start, and one of the things I think is an obstacle, or historically has been, is resources within communities in terms of like mental health resources and access. I do think that with the pandemic, we have, you know, had a greater access to getting the help, you know, via Zoom or what have you, but it doesn't really make up for most of our communities really want to be in person. We want to be able to engage, you know, in that way. In terms of a policy wish list, yeah, I think most of my policy wish list, I have many from the field of psychology, but that would take an entire presentation to do. But you know, insofar as my specific work with activism and scholarship and bringing that together, I think one of the policy changes I'd like to see would be to stop criminalizing activism. You know, I see a great deal of that when if we had, I find that scholars don't often, we get involved in the back door of it rather than like on the ground with it at times. And one of the things is that scholars have a unique position in that they can be witness to and bear witness to the actual experience of the activist. And I don't mean to divide that as a firm line, because many people are both, but when activists that are from marginalized communities are then criminalized, it delegitimizes the very message around climate change or pipelines that exist, you know. And so I think that it's really important to have scholars alongside to bear witness to and legitimize, you know, the very legitimate points that marginalized communities are experiencing and you know, reporting on. So that would be my thing.
I'll add a little bit to the policy wish list. I think I've experienced from my own disaster-related research. I think there has to be my research also shows, and others, that poverty is a big driver for mental health. So some policies that would alleviate this poverty, in particular the poverty traps that we have in Deep South and Southeast, is important for us to start thinking about this problem. And then, of course, the subsequent dependence that comes out of these mental health issues and some other complex problems. And of course, this would also relate to our capacity then, mental and physical, because mental deterioration then affects your physical health, right? And all of this drags you back to these vicious cycles where you were. So this it would impede our recovery or our coping strategy. Also, in areas that are in poverty, the education is very low. The risk literacy of these people that live are also lower, and in most cases they do not know what risks they are facing, whether their structures are structurally sound, the houses that they live that could withstand some of the disasters. And unfortunately, also the current disaster aid programs, at least, are built on the historical exposure, where like the counties and the communities are most hit by disasters. But with the climate change, we expect there could be the shift spatially, and some counties that have not experienced prior disaster maybe, or counties or communities may be battered severely by this disaster, but they would be less prepared because they had never received this generous disaster aid that comes because of the disaster declaration. And this whole sort of a structure of the disaster declaration, it's the damages should exceed certain thresholds to qualify for the disaster declaration, and these small marginalized communities never make to that threshold because they are also small. They never make into media, so to sort of create sort of fuss around this incident to channel this disaster aid that comes from the federal government, and they are most of the time trapped. So I think some sort of a more equitable approach to the disaster, more proactive one rather than the reactive that is contingent on the experience, would alleviate lots of mental health and the health burdens.
Excellent. Kayla, do you have a policy wish list, maybe a top 1 or 2 items? So far, we've definitely got focusing on decriminalizing the advocacy. We've got proactively understanding the next counties, communities that are going to be impacted, and proactively preparing them for the impacts of climate change, as opposed to waiting for the disasters to happen. From your perspective of being in the community, and especially in the mental health, what's a policy barrier that you think could be tackled?
Well, specifically, I feel like there's so many different policies, and I think that it's not so much policy for me as it is just sovereignty. It's, you know, these treaty rights being upheld and not being ignored. It's, you know, having the right as Indigenous people to have sovereignty over our lands, you know, and that oftentimes, well, all the time, that's including, that's food, that's water, that's all those things. So it's not, I guess, I think it's beyond policy. It's so that, yeah, that's how I feel.
Yeah, no, I really appreciate you bringing that in there. Could you actually say a little bit more about what sovereignty would look like for those, you know, there's a pretty broad range of people with experiences that may not be familiar. From your perspective, what would it look like for us to have that commitment to sovereignty for?
Well, I mean, it's self-governance. It's, you know, as far as tribal sovereignty goes, you know, most tribes have some form of tribal sovereignty. They have tribal governments, but oftentimes, you know, it doesn't, there's just so many different loopholes for, I feel like, the government, like the overall American government, to come in and do things that takes away our sovereignty. It's not being upheld. Even, you know, I guess an example with the pipeline. I mean, when the government's coming in and putting these pipelines in, they're damaging land, they're damaging water, the pipelines are leaking, they're going to leak. I mean, every time they're leaking, destroying, you know, reservations, destroying tribal lands, or they're completely just taking down whole areas that might have been, you know, tribal monuments of different sorts. It might not look like a monument to you, but those could have been, you know, tribal burial grounds, etc., all those things. So when the government can just come in and just bulldoze over things, they're taking away our sovereignty. So there's got to be other things in place so that we, you know, we can have that self-governance that we should have on our lands.
I appreciate you painting that picture. That's helpful for everybody to get the context of all of the different ways that the sovereignty has been infringed upon in many different contexts. We have another question from Thomas in the chat or in the Q&A. It transitions a little bit about measures. So it's, do you have any suggestions? You know, there's constantly talk about if you can't measure it, you can't see if you're changing it. And so I think one of the questions here is, do you have suggestions for ways to measure both qualitative and quantitatively mental health impacts of climate change or other crises to help demonstrate their importance?
Quantitatively, I'll just jump on quantitative since my research uses quantitative methods and the data is, we can use, this is very imprecise measures, and unfortunately, ideally you would like to have the individual level, some sort of a measure for the mental health things, but it's very difficult to get to this very proprietary data, and accessing this data is very challenging for us. But at least in US, we have like a community level sort of average mental health days. So they ask people respondents, so on average, like in the last 30 days, how many days you have felt depressed, not on the mood and this. So we can sort of relate this mental health, and they do these surveys periodically, and they are those incidents of the disaster. We have like heavy precipitation events that are abnormal relative to historic averages that we can look at. We have this damaging disaster, so we can try to see the correlation, how we like historically observing within this data that we have, if we see any significant relationship. And there has been many studies that show there is an effect. Also, another studies look at this, how climate change impacts also civil or promotes more civil distrust and civil disruptions in the society. Like they did this worldwide study from different countries, and they correlate these civil disruptions to the temperature change and the increase in temperature. So there are some ways we can quantify this impact. And in my personal research relating those extreme weather events to the deaths, we can quantify like increasing, let's say, damaging events by 1 unit, 2 units, or if it becomes like a frequent annually increase, like having $20 billion events, how much deaths could be associated with it because of the opioid overdose. And then it's not an ideal, but we can use this statistical value of life, which sort of captures the value of the lives lost and translate into the losses that are associated with disasters that is hidden, and we do not see it unless we really do this kind of comprehensive research and quantitative analysis to really find out what are these costs of the disasters, true costs, and how we can address this. Because currently, like mental health problems is measured, the cost is measured in terms of the direct treatments for the illness, but direct is one thing, it's very easy, convenient way of measuring this impact, but indirectly we know that this affects our health, productivity, it affects our income and all of these things, and the subsequent loss in the productivity and your happiness generally declines the welfare. So how we can quantify this comprehensively is important, and we should try, because otherwise we do not see this, so we assume that the costs are low, right? So I think whether it's precise or imprecise, it's still better than assuming that there is no hidden impacts or costs to this problem.
I can jump in with a little more too on that, just from my perspective. One thing is that most of the measures for mental health were not necessarily created by Indigenous people. So there's a lot of privilege there in terms of the kinds of questions and where the value is placed on what constitutes one's well-being, one's mental health. There's a lot of economic privilege to that as well. And so I would think that, qualitative research looking at, collecting the narrative and the stories of the people who are experiencing climate change would be of critical importance. For instance, just thinking about climate change earlier in preparing for this, I was thinking, it's not just the direct impact to an individual going through a disaster because of a hurricane, for instance, or because of a pipeline. There are other aspects to this of, like, at least from an Indigenous perspective, the loss of our traditional medicines, as these plants no longer have an ecosystem that is going to survive. That is a horrific loss to me personally when I see that, or the loss and the impact to our children of what they no longer will have access to because it's been eradicated and wiped away. So I just wanted to share that.
Yeah, that's an important aspect. It's sort of intrinsic value that people place on this ecosystem that is very vital, and that their disappearance could amount to huge losses societal.
Absolutely. I think the recognition that extinction is permanent is very important, especially in this context. So we only have 3 minutes left with our time together. I know it's gone by quickly. And so the last thing that I will leave you with before I do some logistical stuff is, what did you not get to say that you wish you could have, that you want to leave everybody who's here today with? And we'll start with you, Kayla. What is one thing that you didn't get to say that you really want people to know about your work?
Oh, well, so many things. But one of the questions that you all had prepared me to answer, I was really looking forward to saying a little bit about that, and that was around cultural competency and mental health. And I think that it's very important to speak to that just a tiny little bit. And Marge Smith had mentioned that the federally recognized tribes, there's 577 federally recognized tribes, and there's just as many unrecognized, especially in Cali. There's different rancherias, the Pomo people up in the north, like some of them are recognized, some of them are not. It's, that you find that in every state. There's some recognized and some that are not. And I say that because when it comes to providing mental health services, having gone through a master's in social work, getting my degree, there's a book that had one chapter for all Native people, how there's 577 federally recognized tribes and just as many not. So I feel like from what I see, cultural competency is a huge piece, huge piece. And people think that they can look at one book, one chapter and understand or think or pretend to understand who we are as people. And we're very different. Languages are different. There's so many differences. And I see that as just being a constant problem. And I think that people need to understand and recognize that's where a lot of the challenges lie with providing mental health, because often there might not be a Native practitioner, there might not be a Native therapist, and we have a hard enough time even being open to non-Native people for a variety of services, let alone our mental health. And then going through having to explain who you are, explain intergenerational trauma, explain the historical trauma, explain all those things that made you who you are today, all the loss of how we raise our babies, how Native women raise babies and bring babies into this world. It's so much of that has been taken away, and I'm in a generation now where I'm just not reclaiming those things. My mom didn't have any of that. She didn't know any of those things. I'm breaking generational curses within my own family. And I think that having to explain that to somebody who's in mental health, that just takes away from all of it. And I've went through that. I've had to explain all these things about myself to someone that I went to for help, to get my own therapy, and it just didn't work. So I think that I just had to say something about this cultural competency. And I'm grateful that there's been a lot of companies and organizations during the pandemic that I guess there was a kick in getting cultural competency trained. So I've been able to train a lot of non-Native people during the pandemic. I don't know if they're bored or because of the climate with all the things happening in this country. I don't know, something or another. I'm grateful that I've been able to do that, because a lot of people need it. A lot of stuff that we say that no idea. people have no idea. No one even knows half the tribes in their own state. If you ask somebody, they couldn't even name one tribe. So yeah, I'll get off my pedestal, but I had to go there for at least a brief moment. So let me go ahead.
That's where we wanted you to go. Absolutely. Now, Marge and Mary, maybe we don't have time for as extensive, but you've got like 15 seconds. Go. Mary, you're first.
I think we just do our own share to address, to study whatever we can study, whether it's study or contribute to the awareness of the climate change. And I think we will see this incremental efforts would make an impact on aggregate. That is what I would say.
I really appreciate that. Marge.
Sure, I would just say, stick with your passions. Everything I've done within my career has been something I'm really committed to and passionate about. And I think that we can all make those changes together.
So I am hearing that recognition and appreciation of the cultural differences among us is extremely important. And then the second thing that I heard from both of you is that it is not about doing the absolute right thing. It is about all of us doing what we can. So with that, I will leave you to go to the next thing, but I do have some quick announcements, some logistics. Thank you so much,
Yes,
Marge, Mary, Kayla, Jasmine, for bringing your wisdom, and the audience, thank you for bringing your energy. Stick around in this room if you want to participate in a healing practice with Kayla. She'll be here for another, I don't remember how long, 15-ish, 20 minutes of a healing practice. Then there will be a dinner break. Then there is networking happy hour followed by Sci Art Night. If you